let's go ahead and look at the guidelines here of who should be getting the Pap test and the HPV test. Now, this is according to the American Cancer Society, correct?
Right, and now I've discussed this in prior testing here. These are the current guidelines of the American Cancer Society, and the average Pap smear should be start at age 21, not prior to age 21, and they should be tested every 3 years. Now, you have to understand that some of this testing require HPV testing, so if they're not doing the cut testing prior, at the time of testing, especially under the age of 30, they should be tested a little early. Meaning cut testing should not be done prior to age 25 because it's so common for the HPV to be present in that time period between age 21 to 24 that the cut testing of HPV should not be done prior to age 24. Now, as far as testing after the age 30, the current guidelines recommend the Pap year every 3 years or every 5 years if HPV testing is done. Now, this is very important that patients, even though these are the current guidelines, I think the majority of obstetricians in this society tend to repeat the Pap smear, at least see the patients once a year, because there could be other lesions that might not be associated with HPV. So even though the guidelines recommend the Pap smear every 3 years, that your recommendation is still to have your annual exam with your doctor and determine whether those tests were done properly or not.